Again, it's a question very interesting. Best way to relieve an obstructed Foley. So I have put a question on Foleys so that you can understand a lot of important things on this. When we talk about Foleys, how a Foleys get obstructed? How a Foleys get obstructed? The answer is, this is the bladder, this is the bladder, this is the tube, and here this is the bulb. So many a times there are adhesions of the bulb with the bladder wall, and the second is, many a times the crystals precipitate. You may have used normal saline and the crystals precipitate and this may block. So the one very important thing is obstructed Foleys, how to remove it. The first thing that you have to understand is that this bulb has a capacity. So if you overinflate this bulb, so overinflation with 10 to, or you can say with 25 to 30 cc saline or water, this is going to cause rupture. Students, this is the first line. This is the first line method. Remember, if it fails, then the best technique is USG guided suprapubic puncture. So USG guided suprapubic puncture of bulb, and this is very important. So with a spinal needle, you are going to puncture it, and this is actually considered the best. In the era when this USG was not available, people used to push ether and they used to go for chemical dissolution. Important thing that you all have to understand, that today chemical dissolution is absolutely contraindicated. Chemical dissolution is absolutely contraindicated. When we talk about chemical dissolution, why? Because there is increased risk of chemical cystitis. So increased risk of chemical induced cystitis, and that is why it is absolutely contraindicated. So if you go to this question, the best way, answer is USG guided puncture. If I change the question and say which is not, so answer will be the chemical dissolution. And cystoscopic removal is not possible for a Foleys. How the Foleys is there, how can you insert a cystoscope?